Good evening, everyone. Let me welcome all my viewers today on Heart Mitra platform. You are watching this program live on Heart Mitra's Facebook and YouTube channels, and I'm your host Sanjeev Mehra. As you are aware, Heart Mitra is created for all of you, so that you keep on getting scientifically correct information related to your heart health to keep yourself healthy. Not only we post information on a daily basis, but for you, we invite leading doctors from across the country who can talk to you as a friend and can answer the questions which you have in mind. We keep on seeing a lot of chats and questions from all of you on the platform around heart failure and around the role of devices, and there's a lot of curiosity around that. So today we'll be discussing about that, and I'm very glad to welcome Dr. Sai Krishna Reddy from the city of Hyderabad. Sir, welcome to the program.
Thank you, thank you, thank you for hosting me.
So yeah. So before I start taking the questions from the audience perspective, let me introduce Dr. Sai Krishna Reddy to all of you formally. He is one of the renowned cardiologists, as I mentioned to you earlier, from the city of Hyderabad. He did his initial masters in medicine from prestigious Jipmer Institute in Pondicherry, and after that he proceeded to AIMS, New Delhi, to undertake his super specialized training in the field of cardiology. After returning, he is working there in Hyderabad. Currently, he is in Omni Hospital, Hyderabad, working as interventional cardiologist and electrophysiologist. In between, he did his fellowship as well in the field of electrophysiology. He has many academic awards to his credit and around dozen publications also. So we know that today we are talking to an expert who can probably answer all the questions we have in mind. Let me, sir, straight away invite you and hand it over to you for your opening comments on this topic, which is the role of devices in heart failure management and generally the heart failure at large. Over to you, sir.
Uh, Thank you, Mr. Mesha. So now the topic for discussion today is about role of devices in heart failure. I just wanted to make a few comments on heart failure because as the management technology is improving in cardiology field, so now we see most of the advances in the field of cardiology. So you can see now there are multiple options available for patients with coronary artery disease. Like in the layman term, we call it as coronary blocks. So once these patients survive longer, they end up in what is called as heart failure. So as there are more advances emerging, there will be more patients with heart failure. In future, we can expect the number might even double up in terms of heart failure. So it is very important to know about the management of heart failure and all options available for the management of heart failure. And it is also important to know that heart failure is the leading cause of mortality worldwide as well as in India. So it will be a pleasure to discuss about the topic, which is role of devices in heart failure today on this Heart Mitra platform.
Yeah. So as you talked about, sir, that the incidence is unfortunately increasing for heart failure, and it is important to manage it as well timely. But before going on to the management options, if you can, sir, help our viewers understand basics about a brief overview about heart failure. What are the leading causes of heart failure, since you mentioned that the numbers are increasing, and what are the common symptoms as well of heart failure, which a person can himself see so that he can visit his doctor.
So we'll split this question into three sub questions. Like, what is heart failure? So heart failure is when your heart is not able to cope up the demands of your body. So that is the clinical condition which we label as heart failure. Just to because the majority of the audience here is community-based people and the patient. So I just wanted to be more of non-medical terminology. So when your heart is not able to meet your demands of the body, we call the term as heart failure. And then what are the types of heart failure? So generally there are many types of heart failure, but in broad terms there are essentially two types of heart failure. One is when your pumping of the heart decreases, we call it as heart failure with reduced ejection fraction. And second type of heart failure is when your pumping of the heart per se is really good, but your heart is stiffer, it is not able to fill in, so that it is not able to pump out. So this we call it as heart failure with preserved ejection fraction. In India, most of the time we see the first type of heart failure, which is when the pumping of the heart is really reduced. And coming on to the second sub question, which is what are the causes of heart failure? I think most common cause for heart failure in India as well as worldwide is your coronary artery disease. In layman terms, you can call it as blocks in the heart. When what happens when you have a major heart stroke, what essentially happens is your blood supply to that region of the heart will come down, and then the region supplied by that vessel will be dead. So essentially leading to decrease in pumping capacity. So this is what we call it as heart failure, the type 1 of heart failure. So, coronary artery disease is the leading cause for heart failure, and there are many other causes for heart failure. I just wanted to touch upon a few of those, which is the second type. The second cause is hypertension. So, I think everyone knows about hypertension, and hypertension is one of those silent killers. So, which is why you need to diagnose hypertension early and then treat it accordingly. Otherwise, once hypertension uncontrolled is for over longer time, what happens is the heart becomes really thicker, stiffer, and over time the pumping also we focus. Recently, we also had the World Hypertension Day, so it is absolutely important for everyone to get their hypertension checked, and then if diagnosed with hypertension, and then get treated accordingly. There are other causes of heart failure, like you have genetic causes also. So when you see people in their family, like their parents and their grandparents and their kids have this problem, then we this is the one scenario where we check up genetics for heart failure. There are other etiologies like alcohol. Taking excessive alcohol is also one of the cause for heart failure, especially in our urban as well as in the rural setting. And other causes like sometimes what happens in pregnancy in the later trimester. So also the pregnancy can develop heart failure. What we call it as peripartum cardiomyopathy, and other causes like stress-induced cardiomyopathy. So when someone is excessively emotional, and that also can cause to heart failure. We call it as Takotsubo cardiomyopathy. And now that the cancer prevalence is also increasing, good thing is that there is multiple options of chemotherapy available. And one side effect of this chemotherapy is it can cause pumping decrease in the pumping. So chemotherapy induced cardiomyopathy. So if I list, there are n number of causes, but these are all important causes for heart failure in our clinical setting, which we really look into. So the third question I think was how symptoms, right?
Common
The
symptoms, yes.
the common symptoms. So I just want to focus on one and the most important symptom for heart failure. So if you or some of your relatives see that someone is really breathless on climbing stairs, and also really breathless when lies down on the bed, but feels a bit comfortable when sitting up, and then feels breathless when he is wearing his shoes. So when he bends forward, in clinical terms we call it as bendopnea. And when a patient feels breathless on lying down, and then a bit better on sitting up, in clinical term we call it as orthopnea. So these few are the very important symptoms and early symptoms which need to be picked up. And then if you are someone known to you have these symptoms, I advise you to meet your nearby cardiologist and get your cardiology checkup done. So the most important symptom is breathlessness, especially on exertion. Exertion in terms of it could be climbing stairs or bending forward or lying down. And other causes, other symptoms are bilateral leg swelling, and which is progressively increasing. The other symptom is recent onset faster weight gain. So weight gain. So when you what happens in heart failure is when your heart is not able to pump the blood, so all the blood will get seeped up into your legs, and you will have bilateral leg swelling as well as you will have weight gain. So this recent acute onset weight gain, and then feeling really breathless on exertion, and then bilateral leg swelling, and then weight gain. These are usual symptoms. We also have multiple other symptoms, but I just want to people to remember these top three symptoms.
Yeah, no, thank you. I think that's a very elaborative, brief you have given about that what's heart failure generally, how one can identify it. Also, himself is two, three symptoms which Dr. Sai Krishna Reddy has shared. I think these are very easy for any individual to pick up. So when someone sees these symptoms and he goes to his doctor to show it, How do you then diagnose it and confirm that this breathlessness is happening because of heart failure only, and it may not be other fatigue issue or a stamina issue? How do you diagnose it?
So if let's say in my OPD, if someone comes with breathlessness, we ask few questions. So I was mentioning like if someone is breathless, really on exertion, then that favors in terms of cardiac etiology of breathlessness. Otherwise, there are a few other etiologies. The other one is your lung related issues. But someone is breathless on exertion, then it focuses me to look at his heart. And then second thing is and then we do basic tests like ECG, 2D echo. I think everyone knows this. And then these two things like ECG and 2D echo really gives 90% of the diagnosis of heart failure. And then we do some blood tests also like NT-pro BNP. So if I want people to remember these three things: symptoms, and then the second thing is get an ECG and then get a 2D echo. What we look in 2D echo is your pumping. In medical term, we call it as ejection fraction. And then the other blood test is NT-pro BNP. So if these three parameters are abnormal, then that's when we label this patient as diagnosis of heart failure. So this is
All
what
right.
how we
So I think if you get those symptoms which Dr. Sai Krishna Reddy earlier told us, then you can just simply go to a doctor and he will advise you these two three tests. Never deny this because these would be very very important for him to diagnose whether this is an heart failure. So now once diagnosed that this is a heart failure, then what is the next step from there? Is it like you straight away use devices, or there are medical management lifestyle? What's the treatment, let's say, how does it carry on progressively from your end?
So let's say once someone is diagnosed with heart failure, like by your symptoms and then ECG, 2D echo, and NT-proBNP, then so this is the final effect of whatever was the cause. So we in the previous question we discussed about what are the causes of heart failure. So we retrospectively now look at what were the causes for heart failure in this patient. So someone be diagnosed as heart failure, then we look into what made him to go into heart failure. Let's say he's excessive alcohol intake or those are other things. And then does he really have blocks in the heart? Was it the reason for heart failure? Let's say the reason for heart failure was coronary artery disease, which is blocks in the heart. So we do angiogram and then find out the blocks in the heart, and then if you fix the blocks, treat the blocks, generally the heart failure will improve if that was the only culprit. And then you look into the reason for the heart failure. And finally there are some other general management options for irrespective of the etiology of heart failure. So one is we give medical therapy. So medical therapy itself will be a long topic of discussion, so I don't want to go deeper into the topic of medical therapy. The second thing is all patients, irrespective of the cause for heart failure, we tell them to have some lifestyle changes. So what are the lifestyle changes? Like let's say this, if this guy is a smoker, then we of course tell them to stop smoking and then stop alcohol intake. And then other thing is let's say if this patient has risk factors like chemo related, so we try to change his chemotherapy medication, which has no effect on the heart. And other two basic important things which all patients with heart failure, irrespective of the cause of heart failure, I want to remember is: one, to restrict their salt intake. Typically, we tell them to take less than 5 gram. I essentially tell them not to take any salt at all, almost like negligible salt. Second thing is restrict their fluid intake, so which will be less than 1.5 liter per day. So if I want to you guys to remember what are the most two important lifestyle changes which all patients with heart failure has to be followed is: one, decrease salt intake; two is to decrease total fluid intake, which is less than 1.5 liter per day. The other funda would be like if someone is able to measure how much is their urine output, we tell them the next day his intake should be at least 200 to 300 ml less than his previous day urine output. So I think these two important things needs to be remembered in terms of lifestyle changes. The other third important thing, which is our topic of discussion today, is devices in heart failure. There are multiple devices which has come up in the recent decade, which also help in on top of medical therapy and lifestyle changes, also help in management of heart failure, which we'll discuss in the coming session.
Yeah, sure. No, I think these are very specific guidances provided by Dr. Sai Krishna Reddy. So thanks for that. We have a question coming in from Nepal, wherein the gentleman has an LVF of 25 to 30%. So he falls in what category? What's your
So,
general advice to him?
so this will be our heart failure with reduced ejection fraction. So when someone with heart failure comes to us, I was telling you, right, we do a 2D echo. And then in 2D echo, I was telling you that EF, so this guy LVEF is left ventricular ejection fraction. So this, we look in the 2D echo, and the normal value is 55 to 60%. And you can clearly see his ejection fraction has come down significantly from 60% to around 25 to 30%. So we have categories of heart failure. So this comes under severe heart failure, severe heart failure. So, but you cannot just based on this number can suggest which type of therapy. So we has to look into his causes for heart failure. I was telling you, right, like if it was heart block related, then you will have to take care of the blocks. If there was other causes, genetic or other usual things is cardiomyopathy. So if it was cardiomyopathy related, we suggest four pillars of medical therapy, and then the usual lifestyle changes which I was telling, and then we look at specific parameters. So if this guy comes to me, then we do an ECG, and then I recheck his 2D echo, and then we have specific criteria. And then if he fits into those criteria, then he becomes eligible for the devices. And there are multiple devices. We also look into which type of device is needed for this patient to help him better in management of heart failure. So just based on this
Okay.
number, we can tell that this patient has heart failure, and then we need to look at his cause for heart failure, and then is he really an eligible candidate for heart failure, and what type
Yeah.
of device depends on other investigation, essentially our 2D echo and then ECG.
Okay, so I think the answer to your question is that you have definitely a severe heart failure, and we will talk about the pacemakers. You can contact your cardiologist. Kathmandu has some very good cardiologists over there. In case you face any challenge, please come to the nearest Indian big city, and help would be available out there very easily. Sir, let's move on to the next question. And since we will talk about devices now, lifestyle measures, medicines done. So, at what stage or how do you determine that now this patient may require the devices or pacemakers?
So all patients, general dictum is put them on medical therapy, and then as well as lifestyle changes. So depending on the type and the reason for heart failure, the cause of heart failure, we typically wait for around probably around 3 months, and then see the effect of medicine, reassess the patient, relook his echo, and then see if he's improving. If there is definite significant improvement, then we continue the medical therapy. And then if there is not much improvement despite of our medical therapy, despite of our coronary intervention like doing CABG or doing stenting, then we reassess him, and then we look at his ECG, and then see if he's eligible for any of the devices. And then depending on his ECG parameters and his 2D echo findings, then we suggest some devices depending on his criteria satisfied.
Okay.
So
So I think
generally,
there are very, very clear guidelines that what kind of patients will be requiring devices. So it's a choice and it's a decision of your cardiologist. So trust him, when he suggests you that now you need this kind of a device. And Dr. Krishna, we have heard about different types of devices and pacemakers as well. Can you help us understand that what are the main different types of these devices, and how do you decide that which patients may need what?
So talking about Indian setting, normally there are a few devices options available for patients with heart failure. The most common device is ICD. So ICD stands for intracardiac defibrillator. And then there are other devices like CRT-P or CRT-D, so cardiac resynchronization therapy. And there are other high-end devices which generally we don't use. I mean, we rarely use this, but these two are the predominant devices which we use in heart failure. One is ICD, your intracardiac defibrillator. The two is CRT. And then what ICD, so like if you look at the natural course of heart failure, so someone has the cause for heart failure, and then he ends up with heart failure, then what happens to him in the later course? Let's say let's follow him for the next decade. So what happens is depending on the whatever reasons, his LV function, so the ejection fraction in 2D usually keeps dropping down depending on the individual patient, and then he gets readmitted, and then every admission his ejection fraction drops down, and then every admission itself is a precursor for the next admission. So that's how. So there will be waxing and waning course of these patients. There will not be a stable course. So essentially finally worsening, and then finally they succumb to whatever death. So there are usually two causes of death in patients with heart failure. One is progressive pump failure. So what is meant by progressive pump failure is the ejection fraction keeps coming down, so from 55 and then it becomes 50, 45, 40, and then 30, and then 25, and finally he succumbs to progressive failure. The second is which is very important, is your ejection fraction may not decrease dramatically. So let's say someone diagnosed with heart failure and his ejection fraction was around 25 to 40, and then even on follow-up his ejection fraction was with medical therapy remaining stable at 20, 35 to 40. And what happens in some patients, in some group of patients, is he can he can develop what is called as sudden cardiac death. So what is sudden cardiac death is, I mean, you might be hearing it recently also, like most of some of the film actors also succumb to this. So someone was absolutely fine and suddenly collapses. I, and then so this is a typically sudden cardiac death, and this will be even more in patients with heart failure. So what you normally hear in the news and public platform is someone who are absolutely normal and then suddenly succumbing to death. So that's sudden cardiac death, and the prevalence will be even higher in patients with already diagnosed case of heart failure. So in this, his ejection fraction will pretty much remain say, stable, but he succumbs to what is called a sudden cardiac death. And what is the reason for sudden cardiac death is arrhythmias. So what happens is his heart rate fluctuates, like it shoots up to more than 200, 300, and then at that point his heart, instead of contracting, will be just twitching, and then he suddenly collapses. So this can be preventable. So the way to prevent this is we have other medicines, and then the single most important thing is ICD. So we were discussing the intracardiac defibrillator. So what it does is it gives a brief shock to the patient, it resets his heart rhythm, and he becomes stabilized, and at least it buys time for the patient to visit his doctor and then manage accordingly to look at what was the cause for his arrhythmia. So, these are the two ways the patient can succumb.
Okay. So largely, what he explains to us is that there would be devices which will progressively increase the pumping capability of the heart to improve the ejection fraction. And second is that there may be rhythm related issues in the heart due to which sudden cardiac death happens, and other examples he gave. And there are rhythm correction or rhythm stabilizing devices as well. Is it correct, sir, in a
Yes.
common parlance?
So the other device which we are talking about is CRT, cardiac resynchronous therapy. So it does two purposes. CRTD is, the D is defibrillator. So it does the function of ICD, which is it gives brief shock if someone has arrhythmia. And the second thing is, if someone has baseline ECG characteristics fitting into CRT criteria, it also helps in improving his pumping. So it has a dual function. So it improves your ejection fraction as well as corrects you if you have some arrhythmia. ICD only corrects arrhythmias. It doesn't improve your ejection fraction. While CRT, if he is an eligible candidate for CRT, and then it also helps in improving function pumping as well as in correcting arrhythmias also.
Got it. So I hope our viewers would have got a good view today that, what are the basic problems in a heart failure situation, pumping related issues and rhythm related issues, and what are the different types of devices which can help. So there are two devices which can correct, rhythm or pumping, and then there is one which can probably correct both of them. And your doctor would be the right judge to advise you on this, and that will be basis your symptoms and the diagnosis. So I think you need to be really talking very openly and allowing your doctor to investigate you properly to arrive at the right decision. So this is very, very important. Sir, what is the process of this device implantation generally typically involves? So is it like, does it require a long hospitalization? Does it require a surgery? How the device implantation is done?
So generally, like when someone we label them as heart failure, and then we give adequate duration of medical therapy and lifestyle changes, and still his heart failure is not improving. And then, as we were discussing, there were some fixed criteria. If he fits into that criteria, we decide whether he's an eligible candidate for ICD or he's eligible candidate for CRT, and then we counsel the patient accordingly, whichever is best for the patient. So And then generally, what is the common questions or misconceptions which we get in the OPD is, people think that devices is kind of a major surgery, and there are complexities, and there are many things which need to be followed later on once device is implanted. I think there are multiple misconceptions which need to be busted uh, in the OPD itself for patients with heart failure. So, as such, ICD device implantation per se typically involves the procedure time of less than 1 hour usually, and then a CRTD will take slightly longer time. So usually it will be around 2 hours. So once it is successfully implanted, what we do is we like you have the vessels on both side of your chest. We typically implant it on the left side. Everything will be subcutaneous under the skin, and then cosmetically nothing much will be like not cosmetically pretty good. And there are other options also if someone needs cosmetically better approach. And then generally it heals in around 2 weeks time. And then let's say we implant the device today, we discharge usually in 48 hours. It's not a major procedure, usually 1 to 2 hours, and then typically we discharge in 48 hours. And not much follow-up care is also needed once wound is healed, which typically takes around 2 weeks. And then generally there are few follow-up restrictions per se for patients with heart failure, which is like we tell the patient not to lift the left hand above the shoulder level for 4 to 6 weeks, and then not to lie on the left side for 4 to 6 weeks, and not to lift heavy weights for 4 to 6 weeks. Once in 6 weeks, the device typically gets fixed in the body, and then after 6 weeks, he will be back to usual. So no more restrictions after 6 weeks. So
Okay.
I just want to say that generally, if done properly, the device implantation is almost risk-free. And then after 6 weeks, there will be generally absolutely no restrictions for his usual activities.
Okay, so it's easy to fix or implant the devices. As Dr. Sai Krishna Reddy tells us, there are not much risk involved in that. A relatively easy procedure, and there would be some restrictions which your doctor will tell you for 4 to 6 weeks time. And if you take care of that, then it's easy going. But then, sir, once it is, machine is deployed in the heart, and end of the day, it's a machine. So, and then, you can't see it also, it's inside. How can a patient know whether it is functioning properly or not? Or how do, as a doctor, you find out, remotely whether everything is okay or not? So it's a curiosity question which many patients have.
So there are options of knowing your device function. So now recently we also have remote monitoring devices. This updated devices have this option of remote monitoring. So the what happens in remote monitoring is every day or in a week or month you get update to the company as well as to the doctor who has implanted the device about his condition, about the condition of the heart, whether there were any arrhythmias and any other problems with the devices. So let's say usually if there is a problem with the device, so patient will have some symptoms. There could be problem with the device without symptoms also. Idea is to pick up this problem with the device which were asymptomatic. So this can be picked up by usual follow-up care. So what we do is, like, once you implant the device, we test the device on the day of implantation on table, and then so 48 hours later, before discharging the patient, we recheck the device, make sure that everything is fine, and then after 1 month we assess again, and then after that it will be usually every 6 months if the patient is asymptomatic, and the patient becomes symptomatic, and then as and when required we reassess. So this is usual interrogation of the devices. So on table, 48 hours, 1 month, every 6 months.
Okay, so there are options. A patient will get some symptoms if something is wrong, and then that's a signal for him to contact the doctor immediately. And you said that there are options to remotely monitor as well. That's great. So I think you don't need to be worrying. If you're listening to us as a viewer, it's a relatively simple, easy process. It can give you a lot of benefits to you, and then it can be monitored as well. So once device is implanted, then is it all hunky dory for the patient, or he still he needs to have some, he continues to take medicines? So what is the taking care advice which you give to a patient? Does he needs to bring any lifestyle changes still in his daily routine even after the devices have been implanted?
Okay. So idea of implanting the device is not to take take off your medicines. So you will have to still follow your medicine, and then you will still have to follow your lifestyle changes which were suggested to you by the cardiologist. And then as such, for the device per se, there is no much lifestyle restriction. So as we were discussing before, up to 6 weeks you'll have some restriction. After 6 weeks, there will be as such per se for the device you will not have much restriction, and then you can be back to usual. And then so device is additionally on top of your usual medical therapy and then lifestyle changes. It's not that once the device is implanted and you will become miraculously normal. No, it's not, because I was telling you that ICD will not improve your ejection fraction. ICD will take care of one part of the problem, which is arrhythmia. CRT in an eligible candidate can sometimes definitely improve your ejection fraction, but still you need to continue your medicines. Without continuing medicines, the improvement with the device per se is minimal. So you still have to follow lifestyle changes, you still have to take your medicine, and then devices on top of it will work pretty well.
Okay, so a machine will not do the 100% job. It's your body. Still, you have to be careful about a lot of these things. But this device will definitely help you significantly improve, your quality of life and managing the heart failure situation. Sir, since we're also running out of time, I'm cognizant of that. So I just wanted to, also check with you. There are perceptions related to pacemakers or devices that is prohibitively costly. They're very costly. So can you help us understand that these three types of devices which you told, what is the tentative, let's say, cost of getting them implanted, and the benefits which you get out of implanting it? Does that outweigh the cost or the risk associated with that?
Yeah. So I mean now, definitely the devices are costly compared to Indian setting. Like if you look at the Western setting, everything is covered under the insurance scheme, so you don't have to be bothered about the cost there. But here, most of 90% of your is cost from the pocket, so you will have to definitely consider that cost price. ICD, there are types of ICDs. So one with remote monitoring option. So this will be definitely costly. So not for everyone. So there are types of ICDs. One is single chamber ICD, and then there are dual chamber ICDs. So generally, the cost of single chamber ICD costs around 3.5 to 4, and dual chamber will be 1.5 higher on top of single chamber ICD. And CRT-P, and there are CRT-D. So CRT-D is pretty costly. So it will be around 7 to 8 per se for the device, and CRT-P will be around 3 to 4 for the device per se. But good thing is that now that we have one more advanced technology, which is left bundle pacing. So what is CRTD? CRTD is three chamber device. So uh, now with the advent of in the recent past left bundle technology, the two chamber pacemaker itself, if done with good hands, can solve the problem of three chamber device. So in that terms, your device cost will come down significantly by around 1 to 2 lakhs. So there are some options definitely, but relatively the devices are costly. But if you look at the benefits, definitely the benefits overweigh the financial burden.
Okay. And what is the general life of this device? Is it to be replaced after a period, or can you help us understand that as well?
Okay. Yeah. So for the device, there are two parts of the device. One is we call as leads, and the second thing is pulse generator. So lead, you can like in layman term, you can call it as a wire. So what happens is you have two parts. You have a pulse generator. So essentially, the battery and the software is in this. So it will be around a kind of it will be of a Bitcoin size, and then the wire will be connected to that. So we install everything inside the chest, and this wire will be inside the heart, depending on the number of wires. So three chamber will have three wires, and then two chamber will have two wires. So the pulse generator, the battery will be inside this pulse generator. So generally, it lasts for around 10 to 12 years. But depending on the use of the patient, let's say if this patient has multiple arrhythmias, the device has to work multiple times. Then the lifespan will come down. But usually, in an average patient, it works for definitely around 8 to 10 years.
Okay.
And then
So
once the life span is done, then you will have to replace just the pulse generator itself, not the whole setup.
Okay. So I think the cost which Dr. Sai Krishna Reddy told us, it's essentially, for a period of 8 to 10 years. So maybe, that's why he said that, maybe per year cost will be lesser and the benefits which you get out of it are significant. Uh, all right, sir. I think with this, we come to a conclusion. But before, I conclude, I give it back to you for your closing remarks. And also, I would like, sir, in your closing remarks, you tell us that do you get some other misconception also? There are a lot of people, who are hesitant about devices. So if there is anything still, which you face, which you want to explain to patients or viewers, please go ahead with that as well.
Yeah, so as I was already discussing, there are certain myths. So let's say once someone we tell them that you are a good candidate for device and it can really help you. One is financial thing. Apart from financial things, there are usual things like device is a major surgery, which I was already told you is not a major surgery. Other thing is then lifestyle restriction as such for the device per se. Apart from your lifestyle restriction, which are needed for management of heart failure, for the device you don't have after usually after 6 weeks. And then some people ask me whether MRI can be done after the device or not. In the olden days, there was some restrictions for MRI, but now with the new advances, almost all devices now are MRI safe. You can get MRI done after 6 weeks. And then only thing is we need to program your device before your MRI, and then after your MRI we reprogram it. That's the only thing which need to be taken care of. And other thing, people ask me whether can I use my phone after device implanted. Yes, you can absolutely use your phone. Generally, what we recommend is don't use your phone on the left side. We tell them to use over the right here, and don't keep your phone in your shirt pocket on the left side. So these are the usual questions people ask, and then misconceptions. And then some people also, like, usually if a software guy, then he asked me whether they ask general, they think that you can't use your PC or you can't watch your TV. So, and this is also misconception. Absolutely, you can use your PC, laptop, or you can watch your TV. And we advise them not to go closer to your magnetic sources, powerful magnetic sources, and transformers, very close to transformers. And other thing is this metal detectors. So yes, you can absolutely go through the metal detector. Only thing is your device, which is a metal, will be detected. If you show your certificate, then it's absolutely fine. So you can safely travel by air or any modes. There is absolutely no restriction. So these are usual misconceptions which we normally encounter in our OPD. So I just wanted to make them clear that there are, as such, the benefits. If you look into for the device, there are a huge number of benefits compared to the risk. So implanting devices is relatively easier than what is usually thought about, and not much lifestyle impairment or restrictions per se for the device will be there. So I just wanted to clear these
Yeah.
misconceptions which people have.
No, thank you so very much, I think, for sharing in the end these common myths and the facts, which you highlighted on this. So I think you covered the subject today, helped us covered, in a very very comprehensive way. I'm sure the viewers who watched us today live or who would be watching this program later on as well, so they'll get a full clarity about this heart failure space. That what is heart failure, what are the different ways or different treatment modes, who needs a device or a pacemaker, how it can help, and what are the different types, and the myths also were busted by Dr. Sai Krishna Reddy. If you have anyone in your family or friend circle who is having a cardiovascular problem, he is advised by his doctor to explore the devices. I think you can simply share the link of this program with him or her, and this discussion can be very useful for them. So we thank all our viewers with this. And Dr. Sai Krishna Reddy, thank you so very much for taking your time out today and helping our viewers understand this whole subject in such a simplified and a very very sharp way. I could myself understand a lot of things from you today, and I'm sure so are a lot of our viewers wiser after today's viewing of what you said. Thank you so very much, and have a very nice evening ahead, everyone. Take care and bye bye.
Thank you, Mr. Vasan.